Hello, welcome to Wise or Worrisome, Nursing Students' Perceptions of Older Adults. My name is Lynn Brown. I teach nursing at Auburn University, and I'm a member of District 5 of the Alabama State Nurses Association. I don't have any conflicts of interest or any disclosures. I'd like to discuss the problem of ageism and my leadership project, the process, the tool, and interventions that I use, the results, and the implications for nursing practice. You may have heard of the growing aging population or the silver tsunami. During the past century, human life expectancy has nearly doubled globally. In 2017, there were an estimated 962 million people over the age of 60. And in 2030, there will be over 1.4 billion people over the age of 60 globally. So I want you to take away that numbers are increasing not only in the United States, but all over the world. In addition to the increase in the older population, life expectancy has expanded to the current age of 83.8. What are the reasons for the increasing aging population? There have been a lot of advances in public health, education, and socioeconomic development. Also, there's been declining fertility rates that's caused a demographic shift. But the population changes affect both high and low income countries, and healthcare systems will struggle to fulfill the increasing demand for treatment, for hospitalization, skilled nursing, and home health care. The trend of the increasing aging population is expected to continue over the next 30 to 40 years. The World Health Organization states the population of older adults is expected to rise to 2 billion by 2050. With this increase in the older adult population, there will be expanded opportunities for nurses. Maybe some people today might want to consider being a geriatric nurse practitioner. But there's definitely a high demand for workers with training in aging issues. Stereotypes are beliefs about certain groups. Similar to racism and other forms of discrimination, ageism affects individuals and society as a whole. America has an anti-aging culture. False ideas about the physical and psychosocial characteristics of older adults definitely exist in America. It's especially important that nurses are not susceptible to the myths and stereotypes, as that can affect the quality of patient care. For example, some people stereotype older adults as forgetful, disabled, ill, or unable to understand new information. So misconceptions and negative stereotypes may be present in first-year nursing students. It's vital that students assess their own attitudes about older adults in order to gain knowledge about aging and to care for patients across the lifespan. So considering the increasing number of older adults in the healthcare setting, it's important for nurses and nursing students to be aware of these stereotypes and for nurse educators to dismantle negative stereotypes to enable future nurses to better meet the needs of the aging population. Ageism is defined as negative prejudice or discrimination against people based on their chronological age or the perception of being old. Ageism can be self-directed or other-directed. Self-directed refers to ageism directed towards oneself and people one's own age. For example, I'm too old to receive certain treatments or diagnostic tests, or the belief that pain is just a symptom of normal aging. Other directed ageism might be the belief that older patients are always complaining about their health. The attitudes and beliefs and behaviors of nurses toward the elderly individuals affects the care that they're likely to get. So how does ageism among nurses influence patients? Ageism among healthcare providers is prevalent in our society and is a critical factor influencing the care received by older adults. Stereotypical attitudes can be barriers to forming therapeutic relationships with older adults. Ageism also increases the cost and prevalence of healthcare conditions. In the United States, it was found that in 1 year, the cost of ageism was $63 billion, or one of every $7 spent on the 8 main healthcare conditions. The study showed a reduction in ageism would not only have a monetary benefit for society, but a health benefit for older people as well. Even a 10% reduction in the prevalence of ageism could lead to 1.7 million fewer cases of health conditions. Research found that exposure to negative stereotype leads to heightened cardiovascular stress among older persons and predicts their risk of experiencing cardiovascular events along with the cost of treating cardiovascular conditions. So in other words, age discrimination and negative stereotypes lead to negative perceptions of aging. So ageism exposes older adults to age-related discrimination. And ageism shapes the mental and physical health of older adults. Studies found that ageism was lower in students that had cared for older people during their clinical practice. Elder abuse. The CDC defines elder abuse or mistreatment as an intentional act or failure to act by a caregiver or another trusted person. In other words, it's someone that the older person trusts that causes or creates a risk of harm to the older adult. This might include psychological, physical, financial, material, sexual abuse, and whether it's intentional or unintentional neglect. But elder abuse is a global public health and human rights problem that's only predicted to increase with the rapid increase of older adults. Mistreatment of older adults is associated with many negative health outcomes, everything from minor injuries to lasting disabilities. Psychological problems including suicide attempts, increased risk of hospitalization, and premature death. And in an institutional settings, older adults are particularly vulnerable and at a higher risk of being abused. And very few countries have explored the extent of elder abuse in their countries. Bottengard conducted a cross-sectional study of nursing staff in 110 different nursing homes. They asked participants, so these are healthcare workers, how often they had observed staff commit neglect and psychological, physical, financial, or sexual abuse toward residents. Nursing home staff in the 110 nursing homes reported 76% had observed one or more incidents of abuse in the past year. So psychological abuse and neglect were actually the most reported in the study. So it is important that there are preventative strategies to improve the quality of life for older adults. I'd like to thank Arlene Morris and Abby Horton for helping direct my project and Dr. Wang for helping with these statistics. I'd like to tell you that I have an older adult unit in my class, and A week before the older adult unit, I administered this Fabrioni scale, which was a 29-item Likert scale. It had statements such as teenage suicide is more tragic than suicide among the old, or I sometimes avoid eye contact with old people when I see them. Old people can be very creative. Again, it was a strongly agree to strongly disagree. I did get IRB approval and used the last 5 digits of students' Auburn banner ID to be able to match up their answers. So I also included some qualitative and quantitative questions. So a week before the lecture, I had the Fabrioni scale with qualitative and quantitative questions. The next week, we had the lecture, and I did 5 interventions that I'll talk about in a minute. And then a week later, I again administered the Fabrioni scale and had some different qualitative and quantitative questions. Another example of on the Likert scale, I would prefer to live with an older person, or most older people should be encouraged to speak out politically. So the first intervention that I did, I created a 10-slide PowerPoint about truth or myth and asked the students to say if the statement was a truth or myth. Older people are not interested in the opposite sex. Well, of course, this is a myth. And then classic signs and symptoms of diseases are sometimes absent in older adults. And again, that is a true statement. But another statement was older adults are obsessed with death and dying and fear death more than any other age group. And that was a myth. But stereotypes about lifestyles often include living arrangements and finances. So I wanted to see what they said. So that was my first intervention. The second intervention was a video that I showed about an ACE unit, ACE. It stands for Acute Care for the Elderly. An ACE unit focuses on maintaining patient function, and it utilizes interdisciplinary care. It has an interdisciplinary care team that's trained in geriatrics that aggressively manages geriatric syndromes. And usually there's a hospitalist physician that manages each patient's acute medical diagnosis. There is actually about 100 of these ACE units in the country. UAB actually has an ACE unit at UAB Highlands. So it's like a floor or a unit dedicated to care for the elderly with a variety of acute medical diagnoses. The video that I actually had the students watch was from Christus, Santa Rosa, Texas. And it discusses how the specialized focus improves outcomes for the elderly. The third intervention I did was a poem called The Crabbed Old Woman. When an old lady died in a geriatric ward of a small hospital near Dundee, Scotland, it was felt that she had nothing left of any value. But later, when the nurses were going through her meager possessions, they found this poem. And the poem is The Crabbed Old Woman. Its quality and content were so impressive that the staff made copies and distributed it to every nurse in the hospital. And later, one nurse took her copy to Ireland, and it has spread throughout. And I had this poem, I actually asked a student to read the poem, and there is a video of the Crabbed Old Woman, but I did not want them to feel like every old woman was an old Caucasian woman. I wanted them to see whoever they saw in their mind's eye. But this Scottish old lady with nothing left to the world was the author of this simple, eloquent poem. And the poem starts with, "So open your eyes, nurses, open and see. I'm not a crabby old woman. Look closer at me." Like, I used to be a child of 10 or a bride at 20. Or, I wish you could have seen me when I held my first child or when my husband died. But the point of the poem is to remember that the next time you meet an older person, look at this young soul within and realize that you will be there one day too. I will say that you can Google this poem. Sometimes it's called the Old Woman poem or the Crabbit Old Woman poem. There is unfortunately a second part of this that is not very, it is not a reflection of my beliefs or the beliefs of the American Nurses Association. It's a very sarcastic response of a nurse saying, "I don't have time to fuss with you, old woman." So there are two parts of this. I, of course, only included the original poem, but this is what I included with the Crabbit Old Woman. The fourth intervention was older people discussing how they felt misperceived by others in life. And this is an example of the other-directed ageism. They discuss their experiences of other people's misconceptions, saying, they don't realize that I actually go to the opera and that I actually do have a life. They don't even ask about my past life. But findings reveal that the experience of ageism for older adults is very widespread, and it's prevalent in Eastern and Western countries. The fifth intervention is some discussion questions, and I asked several questions to make students think about when their parents were older and to think about themselves when they were aging. You know, when my parents can no longer care for themselves, I will blank. If my parents were living in a long-term care facility, I would want the nurses to blank. The point is, I don't want students to think that all older adults that they're going to care for in the hospital or in the community setting are like their grandparents. They need to realize that one day their parents, their grandparents will be older, that they will be older. As far as the results of the study, I want to tell you a little about the demographics. And as I mentioned, I was able to match up with the last 5 digits of the students' banner ID, how many different students participated in the studies, and 102 total participants participated in the pre and post surveys. 93 students participated in the pre-survey, meaning that 22 did not do the post survey. And 80 participants did the post survey, and 9 of those did not do the pre-survey. And 71 students participated in both the pre-survey and post-survey. And you can see the demographics here, mostly Caucasian and mostly female. One of the things that I discovered was the Fabrioni scale of ageism. Again, it was given pre and post, and there was not a statistical significant difference. So there was not a statistically significant decrease in students' perceptions of ageism, although it did slightly change. But this brings hope that continued interventions are going to increase the awareness of the need for dignity and the need to recognize the desires and needs for older adults. And it does need to be threaded throughout the nursing curriculum. So there can be more statistically significant effects that can lead to improved care for older adults. One of the questions I asked students on the post-survey was, which of the 5 interventions had the most impact on you? And the most impactful was the 2-minute video what is ageism? It was older people talking about the misconceptions of aging. And then the truth or myth PowerPoint, followed by the poem, The Cravat Old Woman. Then the discussion questions, Let's Think. And then the ACE unit video was number 5. This was done fall of 2020 when this class was actually taught online by Zoom. And one thing that is significant is the ageism video that was number 1 and the poem, which was number 3, were new additions to the class. So the newer interventions had more impact. I also asked the students to write in on the pre and on the post survey what were some of the words that they used to describe older adults. And I had a long list, and I asked 5 people independently that were not nursing students, and the 5 people were blinded, to rate the words that the students said, if they were positive words or negative words. And the most commonly used positive words about older adults were wise, caring, and kind. And the 3 most commonly negatively used words by the students to describe older adults were fragile, slow, and stubborn. I also asked students to describe their anticipation of giving care to older adults. They used words like excited and positive, and some of the negative words that the students used were nervous, anxious, and scared. So, the specific needs and desires of older adults must be threaded through multiple courses in the nursing curriculum, and ageism certainly deserves more attention in nursing research. As a nurse or a nursing student, you have the potential to combat ageism, to recognize it, and know that those who look to you, whether it's a nursing assistant or a multi-care tech, they notice the way that you care for the elderly. So be thinking of the importance of interprofessional collaboration and think of combating ageism. As long as ageism is understudied and poorly understood, the consequences of ageism will prevail. And it is important that students are exposed to older adults early in their clinical experiences, because enhancing the nursing curriculum with geriatric content through each course can lead to the valuing of care of older adults. Thank you for listening in your time with my presentation, and I encourage anyone to participate in the Nursing Leadership Academy.